The World Health Organization is launching an initiative in the fight against COVID-19. World leaders have pledged to accelerate work on tests, drugs, and vaccines. They say they will share what they learn with all countries. The WHO's Director General says the only way to defeat COVID-19 is with a common approach. The U.S. has said it will not take part in that initiative, even though more people have died of COVID-19 in the United States than in any other country. More than 50,000 people, and they're still dying. Yesterday, President Trump put out some dangerous ideas for possible treatments. He said UV light on the skin and disinfectants like bleach might work. Here's part of what he said.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
In fact, disinfectants are poisonous. Injecting or drinking them will kill you. As Jackson Proskow reports, there's lots of bad advice, misinformation, and false hope out there, and people like the governor of Georgia are acting on it.
They're back in business in Georgia, where the governor defied health experts and let barbershops, gyms, and beauty salons reopen.
It is a scary time to be opening back up.
The state has 22,000 active cases, adding hundreds more each day. But by Monday, theaters can reopen and restaurants can resume dine-in service.
Who's coming to dinner? I just don't think there are that many people right now who are willing.
Canadian chef Hugh Atchison says he won't be opening the doors of his 3 Georgia restaurants.
I'm totally not prepared to jump right back in without really clear set of guidelines, scientific data backing it up that it's safer.
That battle between science and politics is playing out across the U.S.
I was asking a question sarcastically to reporters like you.
In Washington, President Donald Trump tried to back away from his own comments about injecting disinfectants into the body as a treatment.
But you were asking your medical experts to look into it. Were you being sarcastic with them?
To look into whether or not sun and disinfectant on the hands.
That's not what he said Thursday.
I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
Health officials are seriously worried Trump's words will get someone killed. In less than 24 hours, a Maryland coronavirus hotline received more than 100 calls about consuming disinfectant. The makers of Lysol felt compelled to issue a statement. Under no circumstance should our disinfectant products be administered into the human body. And now the U.S. Food and Drug Administration is cautioning against the use of hydroxychloroquine, a drug touted by the president. Studies into a second drug pushed by Trump have also been called off after nearly 24 patients died. Donna?
Jackson Proskow in Washington, thanks. An Alberta woman with COVID-19 says she was treated with the drug President Trump has talked about. Judy Gabriel was critically ill and she was given hydroxychloroquine. It's been around for decades. It's used to treat malaria as well as some autoimmune diseases. There is no evidence, though, it's effective as a treatment for COVID-19. As Heather Yourex-West reports, Gabriel is recovering now, but she's still struggling with symptoms.
Not easy.
Filmmaker Judy Gabriel shot this video a little more than a month ago. The Alberta woman was in hospital battling COVID-19.
It was a weird sensation because you're feeling like you're going to black out and lose it, like you feel like you're going to die.
Gabriel says by the time she shot these, she was actually on the mend, recovering after doctors took a chance and decided to try treating Gabriel with hydroxychloroquine, an anti-malarial that is currently being studied as a possible treatment for COVID-19.
I remember just looking over and saying, I'm a bit scared, but I was just trying to breathe.
Gabriel doesn't know how she became infected with the new coronavirus. She had been living in Lloydminster when she developed a cough in late February, but she wasn't tested for COVID-19 for nearly a month.
By that time, my fever, my headache, the pain in my chest was getting worse.
As Gabriel struggled to breathe, she says it became difficult to think straight. It's why worried friends enlisted the help of a retired doctor who lived nearby.
I had to say, look, if you don't call 911, I will call 911. So that's kind of what I did. And the most important factor was she was living alone.
Gabriel believes she was the first COVID-19 patient to be treated at Lloydminster Hospital. Within days of receiving hydroxychloroquine and another antibiotic, she says her condition improved, but the medications caused side effects too: nausea, hives, blurred vision, and chest pain. Nearly a month later, Gabriel is still a long way from feeling well.
My chest and back are sore. They hurt. Breathing is still, I cough when I overbreathe, but I got to push myself to kind of get better. That's what you do.
She'd also like to know if she still has COVID-19. She hasn't been retested, so she remains isolated at home, taking each day as it comes. Heather, Yourex-West, Global News, Calgary.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.